There was a time when medicine was a healing art, practiced by neighbors, rooted in wisdom, humility, and the fear of the Lord. But over the last century, it has transformed into something else entirely. A centralized industrial system built on profit, power, and unquestioned authority. Not because doctors are evil, not because nurses lack compassion, but because the structure itself has been shaped by forces that do not love you, do not know you, and do not answer to you. And the structure has learned how to make merchandise of the people. The modern system did not appear by accident. It was engineered. In the early 20th century, the Rockefeller and Carnegie Foundations funded the Flexner Report, a document that reshaped American medicine from the ground up. Its recommendations led to the closure of more than half of all medical schools in the United States, especially those teaching herbal and natural medicine, nutritional-based healing, and holistic approaches. Only schools that embraced a new drug-centered laboratory-based model received funding. This was the moment when medicine shifted from many voices to one voice, from diverse traditions to a single approved doctrine, from healing to industry. And once the system was centralized, it was easy to commercialize. Chronic disease is more profitable than cure. Recurring treatments are more profitable than resolution. Patented drugs are more profitable than natural remedies. Hospital consolidation is more profitable than independent doctors. Facility fees are more profitable than local clinics. Marketing is more profitable than research. This is not a malfunction, this is the design. Independent physicians are disappearing under the weight of liability premiums, insurance bureaucracy, and administrative burden. Hospitals and corporations absorb them, and once absorbed, they must follow the system's protocols. Protocols optimized for revenue, not relationship, and not healing. The result is where a patient becomes a customer, the body becomes a billable unit, and health becomes a subscription. Our children receive more vaccinations than any generation in history. This is a fact, and yet we live in a culture where you are not allowed to question anything about it. Not the schedule, not the necessity, not the long-term effects, not the incentives behind it, not the fact that pharmaceutical companies are legally shielded from liability, not the reality that public conversation is aggressively policed. To even ask a question is to be labeled dangerous. This is not science, this is dogma, and dogma enforced by power is not medicine, it is control. The history of polio is more complex than the sanitized version we are taught. Long before the polio vaccine, infectious disease mortality, including polio, had already declined dramatically due to improved sanitation, cleaner water, better nutrition, reduced environmental toxins. Diagnostic criteria changed over time. Environmental factors played a role, and the Rockefeller Institute shaped much of the early research and public narrative. The point of this is history is more complicated than the stories institutions tell, and questioning those stories is not a crime, it is wise. The deepest problem is not the system itself, it is our trust in the system. We have traded the wisdom of creation for the convenience of institutions. We have surrendered discernment to experts. We have outsourced responsibility for our bodies, our children, and our health to bureaucracies that do not know our names. We trust the state more than scriptures. We trust the system more than the Savior. We trust the marketplace more than the Maker. And what have we gained for that trust? America ranks poorly in infant mortality among wealthy nations. Fertility has fallen below replacement levels. Chronic disease is rampant. Mental health is collapsing. Life expectancy is stagnating. Children are sicker, earlier, and more often. This is not flourishing. This is managed decline. Ezekiel's indictment still stands. The diseased have ye not strengthened, neither have ye healed that which was sick, neither have ye bound up that which was broken, but with force and with cruelty have ye ruled them. This was God's judgment on the shepherds of Israel, but the pattern is painfully familiar. A system that cannot heal you will manage you. A system that cannot cure you will medicate you. A system that cannot strengthen you will sedate you. A system that cannot love you will monetize you. We were told that we were buying the world's finest healthcare. But what we purchased was the most expensive business model ever created. One that needs us sick, dependent, and afraid just to keep the lights on. A system that does not make a people healthy, it makes them customers. And the moment we trusted it more than the God who made us, we stopped being a nation of citizens and became a people of accounts receivable. We are not better off, we are simply better monetized. A system like that does not fail. It succeeds at the one thing it was truly built to do, to make merchandise of you.